ER nurses of Reddit. How often do all those "one more minute and I'd be dead" stories get exaggerated? Before we begin, don't forget to subscribe to the Vancher channel. Also, please share your thoughts on this video in the comments. Let's get started. Story 1. I am Doc here. I had a guy who came in after feeling weird in the chest all day. 40s, athletic, in the middle of a divorce, stressed. EKG looked okay. I see non-specific chest pain all day long, and it's usually heartburn, or stress, or asthma, or a strained rib muscle. And I was so close to sending him out with some Maalox, but there was something about this guy that made me send him to the ED. I asked if he wanted a wheelchair adult worker, and he said, no, head walk. It was about 200 feet. Anyway, an hour later, I logged back into his chart to see how things were going in the ED, and the first thing I see is a code note. Head made it to the ED, gotten some blood drawn, and turned out to be having a mild heart attack. And while the doc was delivering the news and explaining next steps, Head had a cardiac arrest. They got him back immediately, since having your arrest in an ED in front of a emergency physician is kind of a best-case scenario. When I saw him again a week later, he was doing great, but told me that he'd almost gone to get some food. It was lunchtime, before going to the ED, but decided against it. If Head waited, he would have had his arrest in a Jimmy John's, and things probably would not have gone so well for him. Anyway, almost 20 years of practice, and that's my closest call. Answer. I went to the ER once with really bad chest pain that woke me up. Felt like heartburn, but a lot stronger and duller. I felt dumb for going, but I was convinced by a parent since I was only 23 at the time. Turns out I had a pretty nasty case of myocarditis and pericarditis together and was admitted. Also an abnormal EKG and low ejection fraction. Took me 3 months to get all my strength back. So yeah, never feel bad about going in for chest pains. Story 2. Emergency call taker here. Most recent was a small child choking on some food. The ambulance my colleague sent was 10 minutes away, the helicopter 15. While I was giving first aid instructions to the parents, my colleague called the local family doctor, who in a stroke of luck took a last glance at his phone before he would have gone for a run where he would have left it at home. He was there within a minute and managed to dislodge the stuck food. Story 3. One story that I'll never forget is a family of 6, 2 parents, 2 kids, 2 grandparents staying over, who saved themselves from a collective carbon monoxide poisoning by sheer luck. Everybody was asleep. The mom got up to pee and fainted from the CO poisoning on her way back to bed. The sound of her fall woke her husband up, who checked on her and called an ambulance. The first responders' CO detectors went off upon arrival, and they evacuated everyone. If she didn't have to pee, they'd be all dead. If she just made a few more steps and reached her bed without fainting, they'd be all dead. If the husband had a heavier sleep and didn't hear her fall, they'd all be dead. If they thought the fainting was nothing and she'd see a doctor the next day, they'd be all dead. Instead, I had them all in the ER casually recovering from a moderate poisoning, chatting casually about this unusual night they were having, completely oblivious to how close they all got to make the local news the next day. It was eerie. Answer. We got our home, most likely, on a distressed sale due to CO poisoning. An elderly man in his 70s was the former owner. He lived alone, and he'd bought the place before CO detectors were mandatory. The central heating, water heating, stove, and oven were all gas-powered, and it's a seismically active area. All we knew when we first saw the listing and met the agent was the owner's son was handling the sale. The owner had collapsed, had been found by neighbors, and was no longer able to live alone. As we went through the place with the inspector, we noticed the fan above the stove didn't work. Minor issue. We can replace that ourselves. The vent to the water heater had come uncoupled. That was a trivial fix. We snapped it back in place without tools in a minute. Going through the bathrooms, which were right next to the water heater, we noticed soot stains on both ceilings, just the other side of the year from the water heater, looking as if exhaust had oozed into the rooms. It was like piecing together a mystery. We bought the place and told the son what we had found. They hadn't determined the causes of his father's collapse, but maybe that information would help in treatment. Story 4. I recently had a patient carried in by her dad that was peri-arrest from anaphylaxis. Dad was uncomfortable using her EpiPen and thought he was close enough to the hospital to drive in instead of calling 911. She had weak central pulses, no peripheral pulses, and her BP was 5,030s on arrival. She was minutes away from a bad outcome potentially. We did a lot of education and she ended up okay. If you have an EpiPen, know how to use it. Edit. The dad was well-intentioned, appropriately worried when he arrived, and cared for her lovingly at her bedside as she recovered. This wasn't meant to shame him. Emergencies look different for everyone, and allergies evolve quickly. She probably was not that bad when he decided to get in the car, and it's not always easy to know how bad something will get. But he got her to us just in time, which was what OP was asking about. To answer the prompt, there are very few of those cases, which is why this one came to mind. She was safe, and Dad learned a lot, so everyone won. Answer. I recently had my first ever anaphylactic reaction. No previous reactions to anything ever, so I didn't have an EpiPen. I live way the hell out in the country, and my husband had to coordinate with 911 to meet an ambulance out on the highway. I was in and out of consciousness. Also, like a 9.510 on the pain scale. I cannot believe someone would let their own child go through all that, just cause they're uncomfortable. That's crazy. Story 5. I'm a respiratory therapist and work in the ER. It's pretty common to have patients code in the ambulance on their way to the ER, but I think in these situations, they know right away that things are bad and they barely make it. One of the paramedics who taught my CPR class said that since we're in a dense but geographically small municipality with 2 hospitals, the chance of surviving cardiac arrest is much higher than average. They call once they're in the rig and they're outside the hospital by the time report is given. Answer. I heard that sometimes it's believed that even if the ambulance took a little longer, the person would have still coded in the ambulance and not earlier, because sometimes people apparently cling on until help is there, and as soon as help is there, they basically let go. No idea if that's actually real or just belief, but basically the idea is that even if the ambulance would have been just a little earlier or later, the person would have still coded once help got there. Maybe it's just one of those old wives' tales. Story 6. My stepdad showed up at the hospital for a scheduled colonoscopy with a heart rate of 23. He was admitted immediately and given a pacemaker. Not really a 1-minute situation, but if he hasn't had the colonoscopy appointment, he would have stayed home alone all day and probably been dead by the time my mother got home from work. Answer. I had a friend who felt like something just wasn't right and went to her GI doc to see what could be done. She clearly had one of the good docs, so he went ahead and scheduled her. The colonoscopy showed cancer. It's how they found her stage 3C, ovarian cancer. They put her into surgery the next day, and basically, her abdominal cavity below the diaphragm looked like someone had splattered cancer all over it. She was in surgery for over 8 hours. Then she had chemo. She's living with the cancer today, but who knows how much worse it may have been if she hadn't pushed for the colonoscopy. Story 7. I always liked Boyle's response when he got shot in the jerk. The doctor said an inch to the left and 3 feet higher, and I would have died. Story 8. I was patient transport services in high school. My favorite was a guy had gotten in a car accident and had his bone sticking out of his arm. He did the, I'd have been dead in a few more minutes, and kept trying to have all services directed at himself. 1 hour later, they brought in his passenger who had his arm torn off and was impaled through the chest with a piece of a sign after they freed him from the wreck. He demanded starbursts and water ice at our earliest convenience. Story 9. I never really saw this in the ED, to be honest. The human body is amazingly resilient, especially when it has some time to adjust. I had plenty of people walk in, and I was like, holy shoot, how long have you just been walking around like this? In my last job, I had a patient who had a VT arrest while visiting his mom, also our patient, on the telefloor of our hospital. It could have easily eliminated him if it had happened almost anywhere else. He came through it neurologically intact and in pretty good shape, other than needing a heart transplant. Story 10. ER doctor here. It is exceedingly uncommon to see a patient who would have died had they not come to the ER a minute earlier. I have heard numerous patients make claims like this, and in the rare case that it's both potentially relevant to their current care and I have enough time to look, I've looked up the relevant records. In precisely 0 of those cases would the person have died if they waited another hour. Another day? Sure. I've had one personal case where the guy would have died if he had waited any longer to come in. He felt odd, lightheaded, nothing specific, 40-something, Generally healthy guy. Went into VFib right after he arrived. Shocked him out of it. He went back into a fatal arrhythmia a few more times, but ultimately stabilized after more shocks and amio. If he hadn't arrived in the ER when he did, there's a high chance he either would have died or not walked out neurologically intact like he did. Answer. Oncology fellow here. I quite frequently think about the similar anecdotes of, the doctors said, insert family friend self, had less than 3 months to live, but here we are 2 years later. Say I have a patient with a new diagnosis of pancreatic cancer, and they ask about prognosis. The typical answer is, if this goes untreated, and if this is already metastatic, 50% people will be dead in 3 months. Some will have less time and some more. It's usually a skewed bell curve. There is a good amount of nuance in there. I've come to suspect most of those, they said it'd already be dead. Doctors are quacks. Stories are likely a product of remembering only a slice of the conversation, which in all honesty is fair. Expecting someone to wrestle with these nuances in such a stressful situation is probably asking too much. I just tell them, I'm glad that wasn't the case. Makes me wonder if these ED tales are the product of an offhanded comment like, I'm glad you didn't come in even a minute later. Story 11. I used to work with a general surgeon who loved telling patients that their gallbladder, appendix, hernia, etc. was 1. The worst one he'd ever seen. 2. He got there just in time. Patients loved hearing it and repeating it. It wasn't their fault. It was this old bastard's. Answer. I wonder if you worked for the surgeon that removed my appendix. That's what he told us. I was skeptical and I was just an 11-year-old kid, but my mom and siblings just ate that up though. They repeated to everybody that it almost burst on the table. I was already feeling like my fever was going down and I was in less discomfort by the time we got to the hospital admissions office, so I didn't think that it was as bad as he said it was. Story 12. When I was 12, I spent a week throwing up strange colors and having cramps in my guts. At the end of the week, I woke up one morning and it hurt so much I couldn't even get out of bed. My mom was very alarmed, called her friend who said I was probably faking, and to see if I was better by Monday. This was Saturday morning. My mom fortunately decided to call an ambulance anyway, and I was rushed into emergency surgery as soon as I got to the hospital. That week of lead-up was my appendix telling me it was in distress, and Saturday morning it burst. According to what I was told later, another hour delay, and I'd have been dead from the toxic crap my guts were swimming in. As it was, I spent almost 2 weeks in the hospital. Story 13. LD nurse here. I had a patient who was 383, pregnant with twins. She was checking in for a routine induction. History of panic disorder and anxiety, but nothing else. Got her admitted over the next hour. She had some borderline hypertensive pressures, high 130s over 80s. And when I placed her IV, her heart rate went up to 130. Concerning, but in no way emergent, and possibly related to the panic disorder. With no obvious event or explanation, baby A had a precipitous drop into the 50s. I went into the room and her sats were in the 70s, heart rate 178. We ran her to the operating room and delivered her emergently, then transferred her to the ICU. Final diagnosis? Acute heart failure with an EF of 17. It was sheer dumb luck that she was scheduled for an induction within an hour of her heart deciding to crump. Answer. Somewhat related, but the baby was the patient in my case. Was a student midwife doing my first LD internship. Had a patient come in for her pre-induction at 5 p.m., though it was scheduled at 8 p.m., so the midwife told her she could leave and get some dinner first, before coming back later tonight. Just in case, and because she had this gut feeling and did a CTG, I remember her thinking it over if she were going to do one or not. Baby's heart pattern turned very flat, eventually turning pre-terminal. They did an emergency C-section, and baby was transferred to a bigger hospital with a NICU. If she'd have come in at her scheduled time, her baby would have been dead. It was pure luck. Story 14. Couple year ago, I had a 13-year-old boy come in one time after a skateboarding accident who had a sizable epidural hematoma but was neurologically fine. Hospital I was at did not have a pediatric ICU, and I'm not a pediatric neurosurgeon, so was arranging for helicopter transfer. As that was brewing, he went comatose and blew a pupil. So I took him to the OR for a cranny and evac, then straight to CT to confirm no recollection, then helicopter to hospital with PEDS ICU. He walked out the hospital 2 days later, just the nature of epidural hematomas. If he had blown a pupil in the helo, not insignificant chance he would have had permanent injury or been dead on arrival. Story 15. My lung collapsed, and I thought it was anxiety when I finally ended up in the ER. I had to sign a paper and then into a room for an emergency chest tube. The urgency in which they worked around me definitely felt like one of those I could have died moments, but no one ever said it to me. I'm curious if it has ever actually been said to a patient out loud. Answer: I was basically told that collapsed lung, bladder failure, near kidney failure, broken sternum, and manubrium. I was about 95 pounds, I'm 5'10" male, before getting liters of liquid taken out. I was found in a bathtub. My cousin is an ER doctor and basically said I should have been dead. Lymphoma got real bad, and I did nothing cause times were tough. Things are great now. Story 16. ER nurse here. I am of the opinion that I would rather you come in and have us say, "It's nothing, go home," than not come in when you really should. That being said, most of what walks through the front door could be treated at an urgent care during normal business hours. It's cheaper, I guarantee it. I've had 2 patients in my care that experienced those. One guy had a little upset stomach and generally feeling crummy. Nice guy, really chatty. We put him through the CT, and I watched his abdominal aorta dissect as the images came up. The serendipitous part was that the trauma team just got finished with one guy, so they were all 2 rooms down. Guy brought in baked goods for the ER staff. Answer: I do really appreciate when ER staff says, "You were absolutely right to come in." I had sudden, searing chest pain, dizziness, threw up, etc. Basically all the symptoms of heart attack in women things. It wasn't actually a heart attack. It was acute acid reflux. I was embarrassed to have come in until they said, "No, you were right to come in." This could have easily gone the other way. Story 17. As most have said, maybe not 1 minute, but we see patients every day that if they didn't come in when they did, it would have ended much differently. Answer: I walked into an emergency room and they say I had double pneumonia and was in bad shape. I felt like I was gonna die. Basically said they need to intubate me or I won't make it through the night. I was in an induced coma for 12 weeks. No doubt I would have died if I tried to sleep through the night at home, but it wasn't a minute late and I would have died thing. Story 18. Out of my 10 years, I've had one patient. She drove herself to the ER, and as I immediately wheel her inside triage to do an EKG, she went into cardiac arrest. I called a code, started CPR, and we shocked her back awake. Had it been just a few minutes earlier, she'd be dead in her car somewhere. Don't drive yourself to the ER. Answer: I drove myself to the ER when I was 20 and had sepsis from a UTI turned kidney infection. My whole body was shivering, hands were shaking, felt awful but had crappy insurance and was terrified of the ambulance bill. I wouldn't do that today, but poor people do what they feel they have to. It's messed up that these services are so expensive in the first place in the US. Story 19. ER nurse. All the time. I hear them in the ER because it's often the first thing people mention, and they'll go on to use terms that they heard from the doctor that they don't understand, but shows that they were fine. Then I'll look in their records and I'll find it to be BS. But it happens, for sure. Maybe not 1 more minute, but 1 or 2 more days. I'll see that a few times a week. Which, yeah, it's an emergency department. That's what we do. Answer: I'm combing through this thread, and I'm finding a lot of people with 1 or 2 more days stories. Heck, even my mom and I each have one of those. For her, she was just going to sleep off her flu when I convinced her to get a checkup. I felt like something was wrong, like more than usual. She totally thought I was overreacting, but agreed. She was in arrhythmia and had congestive heart failure. She was super close to stroking out, had to stay a week in the ER to get stable, and had to go back later to get shocked. As for me, I had the flu. I was getting worse and worse over a week and made an appointment on Friday for next Tuesday. By Sunday morning, I could barely walk and debated whether it was worth it to call 911. My mom was like, "Yeah." So I called and they had to carry me down my apartment stairs in a stretcher. I was septic, spent 5 days in the hospital, and it would have been a very bad idea to have waited any longer. Neither time was literally a minute, but if we hadn't gotten medical help when we did, it could have gone so much worse. Story 20. Not quite a minute or 2, but hours myself. I was so far into diabetic ketoacidosis before I was first diagnosed type 1. I was so weak I couldn't even make it back down the stairs to get to the ER after a doctor visit. I was in DKA for months before my body started to fail. My mother had left the state for the weekend, so I was alone and couldn't do anything. Thankfully, she came back when she did because even the doctors and nurses said I wouldn't have made it another day. Spent almost a week in the ICU before I was even stepped down to the ER. Answer: same. My dad found me naked, passed out on the side of my bed with my tongue hanging out my mouth. The last thing I remember was the previous night, feeling super weak, having to pee constantly, and trying to stand up, but falling down because my legs were weak and couldn't support me. I caught an infection and was in severe DKA. I had developed sepsis and hypothermia by the time I was in the ER. I was in the ICU for over a week. The doctor told my dad if he hadn't found me when he did, I wouldn't have made it. He was this close to not even stopping by my room, but he said something told him to. It was all very unbelievable because I had never experienced anything like that. I remember in the ER, the doctor was asking me questions, what year it was, and things like that, and I couldn't answer. The last thing I remember was trying to stand, falling down, then hearing my dad's voice in my ear, calling my name, stroking my hair. It was the one time in life I lost track of time. I couldn't account for it. I wasn't dreaming, had no thoughts, no idea how I ended up in the ER. Story 21. ER nurse of 2 decades. TBH, a lot. That being said, we often tell people these things to underscore the importance of them coming in. You have no idea how many people take 2 Tylenol for their chest pain and take a nap versus coming to the ER, or think the worst headache of their life will go away. I've had a few patients where it was literally if they hadn't been in front of us, they would have died. A few. But in the end, I want people to know if shoot seems weird, just come in. Story 22. Not an ER nurse, just a witness. Rush hour morning traffic into the sun. Guy ahead of me on a motorcycle. Truck in front of motorcycle guy. Truck had huge wooden box of some sort vaguely strapped down in the truck bed. Motorcycle sees an opening. Past truck, and he's out of there. Seconds later, box falls out of truck bed, splintering into a million pieces, causing a lot of chaos for those of us behind it. Motorcycle guy dodged passing by seconds and will never, ever know. I still think about you, motorcycle guy. Story 23. My mom was told that if she was 30 minutes later bringing me in to the ER, I would have died. To be fair, I was 5 months old and had a severe case of rotavirus, and I was so dehydrated that my eye sockets were sunken. They also had a lot of trouble getting an IV in me because my veins were collapsed, so they had to put in a port. Story 24. Me, blue lips and short of breath but refused to go. Ambulance came. The ER nurses tried to explain and helped calm my husband before I put in an induced coma. I had heart and lung failure due to sepsis. Chest tubes were placed and surgeries followed. But sincerely, it was the ER nurses and ICU nurses that saved me multiple times from drowning in my fluids and lack of O2. They believed me. It wasn't anxiety. Thank you, nurses. They held my hand and stayed with me when scared. Story 25. To answer your question, not that often, but recently we had a patient who was coming by EMS as a STEMI, then coded in the ambulance bay. Got him to the cath lab immediately, and he survived fully neuro intact and went back to work a month later. If he had driven himself to the hospital, or if EMS had chosen a hospital slightly farther away, he probably would not have had the same outcome. Story 26. The only one I can think of was the dude that coded in the parking lot after driving himself to the ED, feeling short of breath. If he wouldn't have gotten into the parking lot when he did, things could have gotten real ugly real quick, especially if he'd coded while driving. Story 27. A minute? No. However, you realistically have about 5 minutes in cardiac arrest as an adult with no intervention before you'd be significantly brain dead. Anything where you're not breathing, i.e. choking, cardiac arrest. Opioid OD, the minutes absolutely matter. Probably not anything outside of that is so time specific. Answer. My dad went brain dead because he choked, but first responders thought he was having a cardiac arrest until they realized he was wheezing. I couldn't really blame them because of his health and age. A cardiac arrest was the most logical diagnosis. But those single minutes of focusing on a potential cardiac arrest instead of the choking could have made a difference if they realized it on time. Unfortunately, we needed to pull the plug because, although physically he was alive, mentally he was gone. He had multiple epileptic attacks per minute because his brain didn't get nearly no oxygen for a good 7 minutes. But I know my dad's situation was a freak accident at best and doesn't happen often. Story 28. What I hear more frequently is, then this object hit me in the body part, and the doctors said if it had been 1 millimeter to the left, I would have been dead. Story 29. My grandmother, of at the time 80 years old, had her second heart attack on the bus. She got off the bus at the next stop, which was the hospital, walked in and collapsed in the reception hall. Was resuscitated there with AED and back home within the week. The cardiologist was amazed. My grandmother had bruised ribs and a great story. She knew that it was a heart attack because she had her first when she was 65 and recognized the feeling. She had a couple more great years. Story 30. I have a story that happened to me. When I had my hysterectomy, I was sent home to heal. There was a lot of endometriosis, so the cut was huge, and the doctor used staples to sew me back. I had an allergic reaction to the staples. My stomach was swelling up. I went back to the ER, but I had been swelling up, so I had started to break open from where they had closed the wounds. At the ER, I was checking in, and things went sideways fast. I started bleeding out in the ER waiting room. I woke up in the after-surgery area and had to have a blood transfusion, several pints. I have several autoimmune diseases, so it's not crazy for me to have weird reactions to things. My doctor told me I am the only person he ever had who was allergic to surgical staples. Story 31. I exaggerated one once, on purpose, and it saved my father's life. He woke up one morning feeling weird, no pain, no dizziness, just a consistent feeling of strangeness in his chest and stomach. He said it almost felt like indigestion. After drinking some water and the feeling not going away, he asked me to drive him to an urgent care facility. About halfway there, he says to me that he was starting to feel dizzy and he was getting tunnel vision. I knew he had a history of heart disease, so I made the decision to go to the ER instead. As I walk into the ER, the nurse at the desk tells me to take a seat and she'll call me when she's ready. There was already someone checking in at the desk and a line of people behind them. I knew that explaining the situation would take too long, so I pushed the person out of the way and told the nurse that my dad couldn't breathe. That got him rushed past the line and into an open room, where he was found to be having a heart attack. 2 IVs, a crash cart, and a defib later, he was stable. He was moved to another facility where he had open heart surgery and has since made a full recovery. The doctor told me that it was already a razor-thin margin that he made it, and had I taken the time to wait in line or try to make the nurse understand the whole story, he wouldn't have survived. Answer: there was already someone checking in at the desk and a line of people behind them. I knew that explaining the situation would take too long. I got mauled by a pack of dogs way out in the remote desert and had to get driven 30 miles to the ER in town. On arrival, I got wheelchaired to the back of a large crowd at the intake desk. After waiting patiently for around 30 seconds, listening to the people at the front of the queue pleading that their non-emergent issues need to get seen, I finally piped up, "Sorry to interrupt, but I've lost a lot of blood and might pass out if I don't lie flat soon." The crowd whirled around with angry indignation on every face, which turned to surprise and parted, and the 2 admissions nurses' eyes got wide at the sight of me covered in dried and actively leaking blood, head, both arms, and chest. For the next 10 seconds, I noticed the people queued mostly looked defeated and guilty, seeing me in this genuinely bad of condition. Then I got promptly whisked into the back for what turned into hours of surgery and days of recovery. Story 32. I'm not an ER nurse, but I will share my own story. My son was in the NICU after giving birth to him at 32 weeks, complete placenta previa, and I was visiting him for the weekend. I got the worst headache of my entire life and nothing was helping. Next thing you know, I began to feel really weird and couldn't breathe and called the nurse in. I was having a stroke. If I had not been there and the nurse hadn't come in that very minute, I would have been a lot worse off. They were able to get me on oxygen immediately, and it was below 80. Story 33. I don't know if mine really counts, but when my son was 11 months old, he started having respiratory issues. We called the on-call pediatrician, and he tried to explain the whole sucking on the abdomen, and if it got to that, then to bring him in. This was at like 9 p.m. on a Saturday night. I stayed up all night with him while he coughed and didn't sleep and didn't drink any milk. At 8 a.m. the next morning, I took him to my nearest urgent care. They sent me to a different urgent care. I went to that, and the PA gave him a breathing treatment. At this point, his oxygen level was at 82. I knew absolutely nothing about what this meant at the time. The PA said it was up to us if we wanted to take him to the hospital or not. He was completely casual about the whole situation and didn't express any sort of concern, so we didn't think to be concerned either. We decided that we would take him to the hospital, just to be safe, and opted to call an ambulance because the nearest hospital was 30 minutes away. Thank God we did. When the EMTs arrived, they were shocked at the lack of concern and immediately insisted that we rush to the nearest children's hospital with lights and sirens. As we were driving, my son started to lose consciousness. It's been 4 years, and even as I'm typing this story, I have chills. I don't know what would have happened if any different decisions were made that day, and I will never forgive myself for not taking it seriously sooner. We visited the hospital several more times with him, and he was diagnosed with asthma. I will say we learned to take it seriously, and the following hospital visits caught it very early. Story 34. I'm not in the medical field, but I have a cousin who had a stroke while in the hospital for a routine appointment that was unrelated. She made it out completely fine, but she'd have had some real damage if she wasn't literally already where they could help her. Story 35. My one friend is an ER doc, and the other is a surgeon, and they're both here watching TV while I'm playing on the computer, and their answer is, ER doc. It happens. It's not the most common thing, but the reason you hear so many stories about it is because people who really will die without immediate intervention wait until the last second to come in for help. Surgeon. Seconded. I can't tell you how many people will know something is majorly wrong and wait until they're on death's doorstep to get it looked at. The conversation then proceeded about a lady who was shot out of her female body part for 3 months and somehow survived, and it was only known when she came into the ER for her foot rotting off due to diabetes. They used a lot of big words I don't know, but that's the gist of the story. Gross. Story 36. This is before Uber and 24-hour urgent care centers. Got called out for an unknown medical around 3 in the morning. Arrive on scene to find a lady in her late 40s dressed, sitting in the lobby of a condominium building. She was staying at a friend's apartment for the week and didn't have a car. She was embarrassed that she called 911, but she was having such terrible indigestion since 11 p.m. and was afraid she had food poisoning. No problem. We load her up, get a set of vitals, and then she mentions that it doesn't get any better or worse when she lays down or sits up. That is a red flag in EMS. 99 of the time it means it's cardiac related. We hook her up to the EKG, and she's throwing tombstones. My partner and I look at the monitor, look at each other, and both go, shoot. We started 2 IVs, aspirin, morphine, and booked it to the nearest hospital with a cath lab. When we came into the ED, the cardiologist is already there. He takes a look at the monitor, now running a full 12 lead, asks a few questions. We take her directly to the cath lab, and she codes. We got her back after 1 shock, stabilized her, and they proceeded to perform the catheterization. I heard she did fine in the cath and made a full recovery. Story 37. I'm certainly no ER nurse and was obviously too young to remember it or be able to validate, but I'm told that a few weeks or months, not sure, after I was born that 1, I was sleeping way too much. 2, my mother had already had 2 kids, so she knew it was particularly unusual. 3, she took me to the family doctor who immediately called an ambulance, and there was a team waiting when I got to ER. 4, I had septicemia, and it was pretty touch and go. Story goes that my parents were warned they may need to start making arrangements. According to the story, if Mom hadn't already had the experience of having a couple of bubs, then she probably wouldn't have clocked that I was way too sleepy for a newborn. I was told this story a few times growing up, but now that Mom is older, she says she doesn't even remember it, as with most of our early years. No idea if it's true or not, TBH. The other near misses in emergency I remember were the almost monthly childhood asthma attacks that always had Dad racing through red lights and occasionally being stopped by cops, who then escorted us to ER, after which I'd spend a week in the oxygen tent. I definitely remember those, but can't attest as to whether I was really minutes away from passing. Can't really validate the first story, but I always feel for my parents at how stressful it must have been for them with the almost monthly visits to ER for asthma. I'd be terrified if I had to go through that as a parent. Answer. It happens. It wasn't that close with my youngest kiddo, but she was my 4th, and one day when she was about 8 weeks old, she was just not right. Too sleepy for a newborn, exactly like your parents said. No fever, no obvious symptoms. So her dad kept insisting she was fine, but I was like, you know what? Nah, I'm taking her to the ER. By the time we got there, 30 minutes later, she did have a fever, and by the time all the tests were run a couple hours later, she was septic from a kidney infection. Spent about a week in the hospital, but it was never really, OMG, she would have died if you waited another hour. It was, good job noticing something wasn't right, Mom. Glad you brought her in. Story 38. I ended up in the hospital after a tragic end attempt years ago. Multiple doctors told me things like, you should be dead, and any longer and you'd be dead. I was really out of it and even replied, that's the whole point. to one doctor, LOL. They talked about airlifting me to a different hospital at one point. I spent a month in the hospital. I made a full recovery and have no lasting health issues. Story 39. Honestly, most of those stories are exaggerated. It's not that people are lying, but the average person doesn't have a good grasp on just how sick they really were. Without medical knowledge or anything to compare it to, they assume they were seconds away from passing, when in reality they probably had more time than they think. From our side, we see genuinely critical cases every day, so the perspective is very different. Story 40. I have worked as an ER nurse for 5 years now. I can't think of a single patient that was not a trauma patient that would have died had they come just 1 minute later. Story 41. I'm not an ER nurse. However, I am a recovering acute myeloid leukemia patient. I was told that my prognosis wasn't ideal by very skilled and cagey communicators. I picked up on my care team's careful wording very early on. They never made declarations like, "You only have a certain time frame." Making promises and definite declarations opens them up to lawsuits, so they do need to be careful about what they say. The only time anyone came close to saying, "1 more minute and you will be dead," is when I was preparing to have a bone marrow transplant. Unfortunately, the pre-MT testing showed that my leukemia had come raging back. I remember the initial phone call I had with one of my oncologists after the new wave of cancer was discovered. He repeatedly apologized, told me that sometimes he needs to just sit in his car and scream in frustration. Bless him. I can't imagine the stress he works under. I would scream in my car too, while we discussed next steps. Reading between the lines, I definitely understood that no oncologist apologizes like that unless they feel like they have failed. Years later, he disclosed that he was shocked I made it to remission. Maybe I didn't, and still don't ask the right questions in the right manner to elicit a dramatic response. But this has just been my experience while living with a severe illness. Story 42. Bought a CO detector for the first time in my life because of Reddit. That one story about the guy that thought his house was haunted was enough for me. Story 43. One of my CNA coworkers was in the cafeteria getting lunch. A 30-something visitor suddenly collapsed. No vitals. Coworker immediately started chest compressions, while someone else alerted the code blue. Person lived and made a full recovery. I don't know about 1 minute more, but I know if she hadn't collapsed in the hospital around an entire cafeteria of people with vast experience in CPR, she'd most likely have died. Story 44. Ooh, my favorite. I had a patient a few years back. Went in for a routine OB appointment. Her office was connected to the hospital. Important. She was getting over some respiratory bug that her daughter gave her, but was doing okay elsewise. Sat down in the chair for vitals and promptly passed out. BP low as hell. They called a code blue, whisked her to labor and delivery, very quick walk. Ended up doing a crash cesarean, and her belly was just full of blood. Trauma surgery had to get called in to assist, and they found she had ruptured her spleen right then and there in her OB office. Anywhere else, her and that baby would have been dead. They both had great outcomes. Story 45. On the opposite end of the spectrum, we had a middle-aged female come in, breathing relatively fast, appear slightly pale. BP was soft but within normal limits. EKG was fine. She had a AAA in the room of the ER, and that was it. I can't recall if she went to surgery or if it was futile. We also had a Thai boxer come and get hit in the chest at the exact wrong time. Could not get him out of his not conducive to life rhythm. Young like 22. Story 46. Not quite the same, but many years ago, I had accidentally overdosed on fentanyl. Haven't touched anything in 9 years, but yeah. By the time they got me awake, they used 2 bottles of Narcan. My lips were blue and my breathing was so labored that they told me if they were a minute or 2 longer, I'd be dead. Story 47. Not a nurse. I am a lifeguard. I was on vacation, and it's habit to scan the water and count kids. I had a group of small children I counted, and there was 7 of them. I kept looking around, just kind of hanging out on the beach. Next time I looked, there were only 6 of them. I was pretty sure none had left the water. They were on a sandbar type thing and would have had to walk directly at me to leave by walking. I got nervous and got up to look. Started walking out on the sandbar and I could see neon green underneath the water. I swam over. It was off the sandbar, as fast as I could, and pulled a 7 or 8-year-old boy out of the water. Ran him to the beach and slammed his back. I could feel a pulse, but he wasn't breathing. I gave 1 rescue breath, and that kicked his system back on, and he choked out water and started to breathe. If I hadn't been watching, or if I didn't get up to make sure one hadn't gone under, he would have definitely died. The parents were facing away from the water, so they could face the sun. Just assume since the sandbar was there it would be okay. Only 2 out of the kids could actually swim. Story 48. I'm in the UK and will say to patients, I'm glad you came in, or you left this to the last minute, but I don't mean to the literal last minute on the whole. If it's that touch and go, people usually do lose their pulse. Plenty of people go into cardiac arrest on the ambulance or while being wheeled in. I've never had someone come in peri-arrest and got them immediate treatment where I'm like, phew, that saved them from the brink. But some people who have had fantastic responses, known aneurysm payment collapses, and ambulance on scene within 3 minutes. They tell AE they're coming in, and we let the vascular team know, and they start letting theater staff know. Patient spends 7 minutes in our department getting blood tests, including transfusion match samples, cannula, consent for surgery, and handshake from surgeons before being whipped upstairs and surviving. In stuff like this, every minute counts, but I'm never like, 1 minute later would have been the last minute. But I guess, I don't think you had their 15-minute hour to spare, had the same ring. Story 49. I'd rather have patients who exaggerate and turn out to be stable than risk the one who dies. Patient came in, GCS 15, blunt force trauma to the head. GCS went from 15 to 8 in about 15 minutes. Had they arrived a minute later, they could have potentially suffered more lethal consequences. It was horrible when the patient was talking and responsive and then just stopped. Each case is different and depends on highly individualized circumstances, so it's impossible to definitively say if there's an exaggeration or not. Or, patient was in MVC, complained of chest pain, heavy nosebleed and staining down their front. Patient did not mention bullet lodged in upper thigh from incident before MVC. When moving patient to trauma bay from EMTs, blood everywhere. Story 50. Not exactly another minute, but I did find out that delayed anaphylaxis is real. I was prescribed a medication that was of a penicillin variety. I'm very allergic and always tell doctors, nurses, anyone who needs to know. The doctor who prescribed it said that reactions are very rare. About 40 minutes after taking my first dose, I felt weird. Then I started getting a rash on my chest. Then my breathing became a little strained. By the time I got to the ER, a 5-minute drive, I was in worse shape. I remember the doctor saying, "It's a good thing you came in when you did." Story 51. My dad had a food truck chicken sandwich years ago, in the 80s. He was a long-haul truck driver driving home from Quebec to the Maritimes of Canada, and he started to get crampy. Pulled his fully loaded tractor-trailer, lumber flatbed, off to the shoulder of the Trans-Canada Highway and got out to urinate in front of the grill. Said blood was pouring out in his urine. He managed to get back in the truck and got it going again. And not very much longer, he got severe pain in his lower belly. So bad he couldn't push the clutch in all the way. He used the CB radio to try to get someone, but being Quebec, everyone was speaking French and he did not parlay. He finally got one guy to answer, and Dad told him that he wasn't sure what was wrong, but he don't know where the hospital was, or if he could get to it with the big rig. Guy told him to make it exit, whatever it was, and head meet up with him in an ambulance. Guy was a truck running alongside Dad by this point, having caught up to him. Head radio dispatch who called emergency services. By this point, Dad was getting weaker and weaker, and wasn't able to get the truck to come to a halt. The other trucker moved his box trailer in front of Dad, who'd managed to gear down, having never truly gotten up to speed, and Dad deliberately ran into the back of the other driver, coming to a halt. Ambulance arrived and off he went to Campbellton, NB, and into surgery for a perforated bowel and blood loss from a chicken bone in the sandwich. The surgeon told Mom that Dad was about 30 minutes from bleeding out had he not made it to care. Answer. It reminds me of my mom's story. She is a nurse, and on holiday when she was amongst the first of the scene of a crash, the kid had nicked the femur artery and the blood loss was fast. The other just stood and looked at him after having called 111. Mom asked a guy for his belt, and he said, "No, my trousers will fall down." His GF looked at him and yelled, "Give her your fudge belt," and he did. Mom made a tourniquet above the cut and wrote the time applied on him and waited for the ambulance. The paramedics said he would have died in the minutes it took between the tourniquet being applied and them arriving. Story 52. PT here. I was a new grad at the time, like 2 weeks off boards, fresh, working at a rural hospital. I had a eval in the last spot of my day on a Friday for back pain. Woman walks in, and I can tell she's in way more pain and discomfort than what she's put on the intake form. We are going through the eval. Dots for straight musculoskeletal pain were not connecting. Absolutely nothing I did reproduced her pain. and as I'm helping her roll to her side to sit up, I feel her heartbeat in her abdomen. My mind is screaming a AAA, abdominal aortic aneurysm. So I politely adult worker her to the ED below the clinic. Mind you, everyone in the clinic has gone home. It's just me and my newbie skills. The triage nurse heard me out, bless her, and had the woman immediately taken back. The woman I evaluated ended up living. I was right. She did have a AAA that if I had just sent her home, the surgeon told her she would have died because it was very close to bursting. She writes to me on every memorial of the day I met her. She says I was the only medical professional that finally took her pain seriously and that I am her guardian angel. All I can say is thank goodness for differential diagnosis and clinical reasoning skills, and maybe, just maybe, a really scared new grad PT. 6 years later, still a very proud moment of mine, but just doing my job. Edit for grammar. Story 53. I imagine, as a non-ER person, that these types of events are regarding trauma events. Like Jeremy Renner, if he had not had the resources to get medevac to the hospital right away. I know someone who had a widowmaker, but they were very close to the hospital and were able to survive. Story 54. 4th of July weekend. 4 years ago, I was coughing and hacking, feeling lethargic and heavy in the chest. I'd been to urgent care the week before and they said it was likely bronchitis and gave me steroids, etc. I just couldn't get over the feeling, and so had the wife take me to the ER. I was admitted to the cardiac care ward with congestive heart failure. Walked out a week later with a defib vest and an EF of 25/30, which was supposedly twice what I had when I went in. If I had gone to sleep instead, it's likely my wife would have woken up next to my corpse in the morning. I felt sick, but not dire by any means. Story 55. My gallbladder went septic. I had been getting gallstone attacks the previous 2 years. They were so painful that I started to keep a log of each incident. I had no idea what was causing it. I just felt like I was dying for about 45 minutes, and then the pain would vanish as quickly as it came. After having a fever over 101 for a few days, I finally went to the doctor, and he did an ultrasound. I was about 6 hours away from home when I got the call saying that my gallbladder had gone septic and it needed to come out immediately. I drove back 4 hours to another town and checked into a hospital where we knew one of the surgeons, which happened to be the one who took the gallbladder out. He said he was very close to opening me up completely to get all of the infection out. A 30-minute surgery turned into a 2-pound 12-hour surgery because he chose to do it laparoscopically. I still don't realize how close I was to sepsis. Story 56. I'm a doctor, not an ER doctor, but I can tell you that things get misinterpreted a lot. I've given patients explicit instructions in writing and verbalized and had them repeat it back to me, and they come back having done completely the opposite thing because they think that's what I said. Story 57. Triaged a not-so-fit guy in his 60s who had pain in his anterior chest, reproducible on palpation. After lifting weights on his Chuck Norris weight bench, we were swamped, so I checked his vitals, normal, and put him in a fast-track bed. Obviously, he pulled a pec, right? But he told me he had some cardiac history, so I tell the doc I'm going to do an EKG, just for shooting giggles. Oh crap, his heart rate is now 37, and he's looking a bit gray. Full workup, EKG normal except bradycardia, cardiac enzymes okay. We're a small hospital, but our consulting cardiologist says he knows him, and hell admit him. But can we just do a CTA to rule out a PE? I went along to CT and watched on the screen as that image appeared, as his aorta suddenly became this massive bulge because he was dissecting all the way from the arch down into the abdomen. I've never run a patient down from CT that fast in my life. It wasn't close, and prayed that hard for the helicopter to get there. He was on the table at the tertiary care facility in another 25 minutes, and they saved him before it burst. Story 58. All the darn time. Heck, the other week I had a guy come in and tell me his heart isn't beating. I assured him it was. He then argued with me, and I smiled while saying, "You'd not be able to tell at me your heart had stopped beating as you claim, sir." Story 59. I'm a psychiatrist, so we don't have a ton of these types of stories, but there is one that sticks out in my mind from residency. I was on call one night when I got a call from an outpatient of one of the attendings in the clinic. The PT's wife said that he had recently started a new medication and wasn't feeling well, and just wanted to make sure it was nothing serious, apologizing for bothering me. I looked in the PT's chart and noticed that he had a history of liver issues and was currently being monitored and treated for cirrhosis. The medication he had recently started was known to be hepatotoxic, or potentially damaging to the liver. The PT's doc should not have started the medication given the PT's history. I discussed the situation with his wife, who reported that her husband had been feeling ill, vomiting, felt weak, had abdominal pain, and when I asked, reported that his skin and whites of his eyes were yellow. She also noted that he had been displaying progressive confusion and seeming out of it. I told her not to give the PT the new medication anymore, and to either bring the PT to the nearest emergency room or call 911. She asked me if that was really necessary, as she and her husband were already in their pajamas and were going to go to bed soon. She asked if they could just go to urgent care in the morning. I basically said, "Ma'am, if that were my father, I would either be on the phone with 911 right now or getting in the car to come over and bring him to the emergency room myself." She seemed to take that seriously and said that they would get dressed and go in. I checked in about 1-2 hours later on the PT's chart and saw that the wife did bring her husband in, thankfully, and that he was immediately admitted to the ICU with acute liver failure. His exam findings and labs were pretty terrible. Had he and his wife gone to bed with the plan of going to urgent care in the morning, he would likely have died. Otherwise, I have definitely heard my fair share of PT stories about being on the brink of passing when they weren't, having experiences within healthcare that would never happen or are impossible, or presenting labs exam findings med doses that are meant to show the severity of something that do the opposite. Most of the stories I've read on Reddit about people reporting they woke up during surgery seem incredibly exaggerated, if not completely made up, based on the way that ORs are set up and how surgeries are done. Just about any story you see, including things like, "So the nurse saw my leg and just started screaming," or "All the doctors and nurses were shocked and had no idea what to do," are likely exaggerations as well. There is very little that actually shocks medical staff, and nurses have seen shoot and can handle a lot. I've had numerous patients sit down in front of me and say that they are likely the worst, most fudge-up person I'll ever meet, that they've gone through the worst trauma I've probably ever heard of, or made comments like, "Yeah, you're probably wondering how I'm even still alive right now." In all cases, they have been wrong. The worst, most fudge-up patients I've ever met don't consider themselves so. The worst trauma I've ever heard of has come from patients who don't put a lot of thought into comparisons. There are definitely PTs that amaze me by still being alive, but none of them boast about how bad they have it like there's an award for the most suffering a human being can experience. Story 60. Just like police officers, firefighters, or even doctors who claim, "If you were actually wearing your seatbelt, you would be dead," or "If your car flipped one more time, you would certainly be dead." I hear this from lay people all the time, but never in my life have I met a first responder who would ever make that statement. Let alone can I think of situations where it might even be true. Story 61. Not an ER nurse, but my grandfather had an aortic aneurysm rupture in his sleep. Something woke my grandmother up and she still isn't sure what it is, but she looked over at my grandfather and found him all but dead. She called 911 and they got him to the hospital alive, only to be told they couldn't do the surgery to save his life, and worse, it was storming outside so they couldn't life flight him. So he got transported 25 minutes to a hospital big enough to save him, where one of the best heart surgeons on the East Coast just so happened to be there temporarily, who they woke up and met the ambulance at the hospital. You know it's bad when the surgeon admits he doesn't understand how my grandfather made it to his operating room alive. Grandfather ended up in a coma for 10 days, remembers absolutely nothing. Last thing he remembered was going to bed, woke up 10 days later. Story 62. The people don't exaggerate the stories, as it's usually the doctors and medical staff telling them things like that. The reality is that they really don't know, and they want people to feel grateful and to take steps to not get in the same position again. If you can strike the fear of God into someone, maybe they will make different choices next time or choose to get healthier. Story 63. This was me, not a nurse. I OD and basically was in a coma for 24 hours. Woke up, vomited, and waited until the next night before calling an ambulance. I had poisoned myself with paracetamol, got brought in immediately and given treatment. I think if I left it any longer, the damage would have been fatal. Fun fact, as a result of that and getting blood tests, they discovered that I have an incurable liver condition. So attempting to end things may have actually saved me in the long run. Life is confusing. Story 64. ER nurse here of 15 years triaging people. People lie. If they tell you that they were a minute away from dying, they're embellishing. The ones who were actually a minute from dying couldn't tell you because they were actually dying or close to it. Story 65. I worked in the ER as a doctor, and I've never said that, to be honest, nor have I seen many cases where that would be the case. Perhaps just heart attacks and strokes within the period for thrombolysis. Story 66. Not a nurse, but a patient. I was bleeding internally so much that I became unresponsive on the way to the hospital. I didn't really wake up for more than a few moments at a time for 6 hours. My hemoglobin was 4 GDL, which is apparently really bad. Story 67. Not a nurse, but my closest experience to this was when I had a blood test that showed my ferritin level was 2. Worse, with the added context that I was a pescatarian 14-year-old who had a really heavy period. My blood was so low on iron that my red blood cells were smaller than normal, slightly the wrong color, and I even noticed once after getting a small cut that my blood didn't even have any sort of metallic taste. Not exactly life or passing, but still really bad. So bad, actually, that people who knew me were amazed I was even able to function and had never fainted. And I had people apologize to me for assuming I was just unfit or something when I struggled with physical activities. Story 68. Absolutely, some people are exaggerating what they are told because they don't quite understand it or think it needs dramatic effect. It doesn't. If we told you you were near passing when you came in, you fudge were. That should be enough. Here, though, is the interesting piece. There are far more patients who we save from the clutches of passing who do not get it, no matter how clear we are about it, that they were dying, and we snatch their jerk back. It just doesn't sink in. They can't see it. They don't understand. I promise you, there's enough of them walking around thanks to us as there are the ones who feel the need to exaggerate. Story 69. Not an ER nurse, but I think if you get admitted as soon as you come into a busy ER, your "I was a minute away from passing" claim is probably legit. If you waited at all, it's probably not. Story 70. Also not a nurse, but a spouse of someone who had a close call earlier this year. Husband had been complaining of a sore throat for a week, and I'd been moaning about man flu. I had taken him to his primary care practitioner twice, and he had checked him out and found nothing of concern. No visible inflammation, no temperature spike, lungs sounded clear. On the Friday night, he woke up in the middle of the night with a stabbing pain in his throat. It took to nearly lunchtime Saturday to convince him that the next stop was the emergency room, as per the GP's instructions if things didn't improve, as they had access to imaging he didn't have. We went down the ER, waited maybe 5 hours for him to be seen. They did some standard checks and were about to discharge him when the attending heard him speaking with one of the nursing staff, answering the discharge questions. The attending then told them to get my husband to X-ray immediately. The next thing we knew, he was being admitted to be transferred to another nearby hospital that had an ICU and an ENT ward. He had epiglottis, and the throat was about to fully close. If you've watched The Pit and seen the episode where they have to do the cricothyrotomy, that's what would have been needed if things had progressed further. He wasn't allowed out of line of sight of the medical staff until he was handed off to the transfer team, and he spent 3 days in the ICU while they got the swelling and infection to go down. We found out later that apparently epiglottis presents with a specific sound when speaking. The attending had only ever heard it once before, and we are lucky he recognized it was he walked past. Everything went from 0 to 100 in a blink of an eye. Do not recommend. Story 71. Patient here, fall on ice at work, unconscious. Woke up, argued I was fine. Coworker convinced me to get in an ambulance. Brain bleed caused me to stop breathing and go into fibrillation in the ambulance. If he had not talked me into going into the ambulance, I would have died in the conference room. Story 72. I had a pleural effusion in 2018, and after getting a second round of blood tests in about 3 days, the doctor said to me that I need to be admitted urgently. I asked if he couldn't maybe prescribe me stronger meds or something, and he replied, "I can, but I'm also now telling your husband that he can start making funeral arrangements for the time being. Normal CRP, blood test for infection count, is below 5. First blood test, my CRP was close to 300. Should have been admitted then already, but was terrified to go to a government hosp. And second round of bloods was over 600. Story 73. Animal ER nurse. Had a client call on a Monday morning because she was bitten by her cat the night before, and she wanted to know what to do. Further questioning revealed that on Friday night, the cat got into a fight with a skunk and had several wounds to its face. Found the skunk dead on Saturday. Sunday, the cat was acting weird and bit the owner. Cat died Monday morning. Told owner she needed to bring the cat's body in for rabies testing ASAP. She responded that her husband had already buried the cat. I told, please dig it up and bring it now, and to go right to the hospital. She refused because she didn't want her name in the paper. I told her name would 100 be in the paper when she died from rabies. She hung up on me. I called the number back and her husband picked up. I explained the seriousness of the situation, and he agreed. He had the body to us in 20 minutes and took her right to the hospital. Next morning, we got the positive rabies results from the state lab. That lady would have died because she didn't want her name in the paper. Story 74. I was minding my own business on the couch when I felt my right eyelid droop and my mouth droop on the right side. It happens almost instantly. I knew immediately that it could be a stroke. We rushed to the stroke unit hospital where we live, and even though they didn't find any evidence of a stroke, they said it most likely was a TIA. I was impressed. I was seen the moment I got there. Thankfully, with cholesterol medicine to help reduce stroke risk, I actually have good cholesterol and aspirin. I'm good to go. I followed up an esophageal sonogram of my heart to check for any possible undiagnosed holes. It came back in good shape. So I'm happy to report no anomalies on my MRI or CT scan of my head or neck. I have a heart monitor implanted to monitor for any heart rhythm anomalies. So far, I'm good. I'm glad I didn't ignore it though, because I've seen how devastating strokes can be firsthand. Never feel bad for getting your symptoms sorted out at the hospital. And if you know something isn't right, be persistent in getting treatment for it. Story 75. Not a medical professional, but some 20 years ago, my grandfather went to the hospital after a few days of persistent, worsening chest pain. They took a look into his chest and immediately rushed him into an OR. They got his chest open just as his aortic aneurysm burst. He was in a coma for 2 weeks, but he survived and lived for another 15 years. He wasn't just minutes from passing, he was seconds from it. That's it for this video. Don't forget to support Vancher and my second channel, Vanchus. See you soon.